Let's now discuss the various methods of communicating in the therapeutic setting. Well, what is it to communicate? Well, in general, to communicate is to make known, to transmit to others, to have an interchange as of ideas or information. Learning communication skills will enhance your therapeutic presence and thereby promote healing. Yes, that's correct, promote healing. If you show genuine interest in your patient and their problems, and you communicate that well, that can enhance the patient's recovery. So then, how do we communicate? What forms of communication do the PT and PTA use extensively? Let's take a look. We have verbal and nonverbal skills, reading, writing, and listening. Let's begin with verbal and nonverbal skills. Verbal and nonverbal skills combine to send a message. And did you know that nonverbal communication or body language contributes 60 to 90% of the meaning of a message? This is critical to understand for effective communications. If your body language does not match the verbal message, the message will be incongruent or confusing to the patient. Now let's look at examples of nonverbal actions that can affect communication. For example, think of a time when you were listening to a professor lecture about a topic in physical therapy. The professor asked several questions of the class. Some students are enthusiastically raising their hands to answer, but others appear to be dozing. What assumptions do you think the professor might make regarding the differing communications by these students, and how do you know? Well, now imagine you are that professor. What would you think about the enthusiastic students? What impressions would you have of the dozing students? Well, when I ask students in the classroom setting these questions, they respond by saying those that are enthusiastic are demonstrating engagement and interest in the subject, that they understand the necessity to learn and fulfill their responsibilities by being prepared and eager to participate. As for the students that are dozing, the responses are that these students may be disinterested in the subject, lack motivation to fulfill their responsibilities, and that this behavior is a sign of disrespect to the professor. This is a good example to think about. How often do you look at yourself in the mirror and think about how you are perceived by others? It is good to start thinking about this, as you will assess yourself regarding communication throughout the program, and you will also be assessed by your instructors and your clinical instructors. There are also other examples in the textbook for this course that you may want to look at and think about. So we have been talking about verbal and nonverbal skills, mostly body language with respect to nonverbal. But there is another nonverbal action, which is called internal dialogue, which is defined as communication within an individual, and this may disrupt communication with others. An example of internal dialogue is in the following scenario. Think of a time when you were meeting with your academic advisor. You were listening to his or her words, but you also heard yourself talking to yourself about what you wanted to do over the weekend. The professor noticed that you were not attending to the conversation, but did not know what was causing your lack of attention. Your lack of attention may affect your interactions with this professor in future conversations. What assumptions might the professor have made regarding your lack of attention, and how do you know? Well, in this case, internal dialogue has disrupted your ability to focus on the subject at hand. The professor may interpret this as disinterest and lack of motivation. The professor may also see this as a sign of disrespect. The body language of the professor may then become closed and demonstrate these perceptions. And finally, with respect to body language and internal dialogue, it is important to understand that body language and internal dialogue do not always mean lack of motivation and disrespect, etc. For example, what if the internal dialogue was about a family member with a critical health issue? Or what if the dozing was a result of a lack of sleep? My point? If a person displays poor body language or inattention consistently, then one might perceive these negative attributes. But if this is not their typical behavior, something else might be the cause and should be considered. Another form of communication is reading. It is critical to be a good reader, as reading and understanding of medical information is essential for patient care. In addition, good reading skills helps you to evaluate professional literature and use findings in your practice. Another essential communication skill is writing. This is an essential skill for clinical care and communicating with other professionals. As well, it is often a determinant of reimbursement. Claims may be denied because of inadequate documentation. And finally, listening is a foundational communication skill for success as a professional. Performed properly, it lets the speaker know that you have understood the intended message. There are 3 elements of active listening: restatement, reflection, and clarification. Restatement is simply repeating the words of the speaker as you have heard them. Reflection involves verbalizing both the content and the implied feelings of the sender. An example of reflection would be something like, "So what you are saying is your knee hurts and you're concerned." Clarification goes one step further and involves summarizing or simplifying the sender's thoughts and feelings and resolving unclear verbalizations by the sender. An example of clarification could be, "So as I understand it, what you are saying is your knee hurts and you're concerned about the recovery time and the cost. Is that correct?" So in summary, you should learn about these and think about these different communication skills. These will enhance your therapeutic presence and thereby promote healing. Now let's look more closely at written communication. Every patient has a medical record, and you will be involved in writing in this record for each patient you treat. There are several types of medical records that include the narrative form, the pre-established form, and the SOAP note form. You may be writing these notes on paper or inputting information into a computer program. In addition, patient education can include written materials that you will produce and use to teach patients about exercises, proper lifting techniques, and the like. As for the electronic medical record, it is beyond the scope of this class, and you will receive more on this as you progress through your program. Now let's look at the fundamental forms of note writing. To begin, we have the narrative form as seen on the slide. You can see that the names have been crossed out for confidentiality. This form follows the paragraph form as if you were writing prose. Much like reading a book, this method tells the story of the patient in a free-form style. You can look through this note and see the different paragraphs and the different information that is provided. Here is an example of a pre-established form, and this is commonly used. With this form, pre-established categories are contained within the document, and the medical provider essentially fills in the blanks. You can look at this form and see the different information. For example, here we see ROM, or range of motion, and this is where range of motion is recorded. Here we have muscle function. This is where muscle function is recorded. So again, the pre-established model has categories contained within the document that you fill in. The SOAP note is yet another common method of documentation, and I expect you to know the format of a SOAP note. SOAP is an acronym for Subjective, Objective, Assessment, and Plan, and each category contains specific information. It combines the best of narrative and pre-established forms of documentation. Now let's break down this acronym. First, we'll look at the subjective section. This section contains what the patient or family member describes, and it's basically the patient history. So for example, the therapist will question the patient on where their pain is, have they had pain before, etc., and all this information is contained within the subjective section. If you look at the example in the slide, the subjective section says that the patient reports she has been walking with a walker 5 times a day for 30 feet. It states that she has been trying to do all her home exercise program every day, that she has no complaints of pain in her right knee. However, she states her right ankle is stiff in the AM or the morning hours. This is an example of a subjective section in which it is the patient's information being described by the patient. The objective section of a SOAP note contains what the physical therapist observes and measures. So here we may see documentation regarding the system's review and results of any tests and measures a physical therapist chooses to perform. In this case, in the example on the screen, this is a daily note, so this could be documented by a physical therapist assistant as well, and includes their observations and measures. If you look in this example, you will see that the person documented that the treatment consists of, and then they list therapeutic exercise, active range of motion and passive stretching, transfers, and gait training. These are examples of things documented in the objective section of a SOAP note. The assessment section of a SOAP note includes the clinical judgment and goals. If the PT uses this for an examination note, the clinical judgment or diagnosis is based on the evaluation and can only be documented by a PT. As well, only the PT can document the goal statements. However, for daily notes written by a PTA, the assessment section includes their clinical judgment on how the patient is responding to treatment and how they are progressing or regressing with respect to the goals for the patient. It is important for you to understand your role as a physical therapist assistant with respect to the assessment portion. Again, a clinical judgment or diagnosis and goal statements can only be done by a physical therapist. A physical therapist, on the other hand, can use judgment on how the patient is responding to the treatment on a daily basis and how they are progressing or regressing with respect to the goals for the patient. The plan portion includes the interventions that will be used and the duration and frequency of treatment. The physical therapist documents this with the initial examination. An example might be therapeutic exercise for lower extremity strengthening 3 times a week for 4 weeks. This is the PT's domain only. In daily notes, such as seen in your slide, the PTA can document how the plan is being followed and cannot add interventions without permission from the physical therapist. So here too it is important to understand the physical therapist assistant role with respect to documentation in the assessment and plan portions of a SOAP note.